are you doing?
I'm in so much pain.
Have you been in this position for quite a while?
I have been. They just kind of put me like this to take the pressure off my back, but I'm still in so much pain.
Okay. Let's try the hands and knees position, which will get the baby more forward and take the pressure off your back. So what you're going to do is just come on your knees and on your hands as well.
Okay. Okay.
How does that feel?
That feels a lot better.
Better, right? Yeah.
Yeah.
And then your support person, you do a little counter pressure massage on
Oh
your
yeah, that
back.
feels great.
Yeah, wonderful.
Thank you.
You're welcome. If you have any other questions, what I'll do is I'll teach you some other positioning that we can do. If you want to start getting up and maybe sitting at the edge of your bed, you can also try that position to get the baby to descend even more.
All right.
How about, okay, so you can try that after you finish with.
How long should I stay here?
For a few minutes until you start to
Just
get
get the
uncomfortable.
pressure off?
Yeah.
Okay.
How about that ball thing? We keep hearing about the ball, some birthing
Yeah,
balls.
should I go
Is that
ahead
any
and
good?
sit on that?
Sure, you can do that if that's comfortable for you, as long as the baby has not what's called crowned, you know, too far down. You could do the birthing ball.
All right.
And it's right here. Okay?
Okay.
Good morning.
Good morning.
I'm your nurse for today. How are you doing?
I'm still in a lot of pain.
Oh, have you tried some music? Music would really help to help you to relax and to be more comfortable.
I guess we'll try it.
Yeah.
She didn't have her headphones today, so let me try this.
Ah, how do you feel?
It's all right, but I still feel contractions.
Yeah. Try some massage. Massage would
Let me
really
get your
be
mind off
good.
to the other end. How's that?
That's a little better.
A little better?
Yeah. It's still really like crampy.
Yeah. And also to help you relax, you can try some great breathing techniques, slow cleansing breaths, and effleurage, where you can massage your belly yourself while your support person massages your back.
Okay.
How about that? All right.
Pain. What do I do, nurse?
Yeah, walking is really, really good. Walking will help the baby to descend further down your birth canal. So try walking and doing that effleurage. It's very good. Good job. And I see you have that birthing ball.
Oh.
You could use that to help the baby descend more. How's that feel?
Feels great.
Wonderful. Good morning.
Hey there.
How are you doing?
I'm still feeling a lot of pain. Is there something else we could try?
Yes, your doctor ordered Pitocin, and what that's going to do is going to augment your labor. But first we have to check your fetal heart rate for at least 20 minutes before we induce your labor. We must also verify that you will be able to have a safe vaginal delivery. We will also time your contractions to make sure that your contractions have a frequency of every 2 to 3 minutes with a duration of about 40 to 90 seconds. And we want you to have contractions no less than every 2 minutes as well, but the interval of less than 30 seconds. Okay, and then also while we're at it, your doctor wants to start you, because you wanted the epidural, right? So we want to have you sign the consent prior to him coming out, and there's going to be a team that'll teach you all about the epidural, but first we have to have you sign the consent.
Okay, and that has all the risks and everything?
Has everything on it, yeah. If you can just take your time. I know that you're probably having some contractions and pain, but look it over and maybe your support person can help you with it, and you'll just have to sign at the bottom.
Okay. Thank you.
You're welcome.
All the side effects are listed?
The side effects, we will have to explain that to her. Usually this just tells her the risk, benefits, and what procedure she's having.
So the doctor can do that?
And the doctor will come in and explain everything. All we do is just ensure that she signs a consent. Okay?
Okay.
Hi, Beth.
Hi.
I'm your nurse. How are you?
Good, how are you?
I'm good. I see that the anesthetist came in and explained everything about the epidural.
Yes.
Perfect.
I
Do you
already
have
have
your
my consent
you have
form
your
too.
consent? Perfect. May I see your signature? I just want to witness it. Okay. Perfect. We have good. Great. All right.
Okay. Beth,
Hi.
How are you?
Good.
My name is Brian. I'll be your anesthetist today.
All right.
Yeah, I hear you want an epidural.
I do. I'm in a lot of pain.
Okay. You got your consent?
I do. I was reading it, but I'm just kind of confused.
Okay. Well, let me try to clear things up. I'll explain it, and then I'll answer some questions.
Okay.
An epidural is a catheter that will go in the bottom of your back here.
Uh-huh.
It'll stay in for the duration of your labor. We're going to deliver naturally, right? We're not having a C-section?
No.
Okay.
No, it's natural.
It'll take care of most, if not all, of the pain, but you still will be able to push.
Mm-hmm.
So you'll have motor control, and you will be able to feel pressure.
Okay.
It won't get rid of absolutely every type of feeling, but the uncomfortable sensations it should get rid of.
Okay.
Okay? Any other questions about it?
What's going to be inside my, like, what kind of med are you going to give me?
So we use a local anesthetic called ropivacaine.
Okay.
That will help to numb the nerves.
Uh-huh.
We'll also use a little bit of fentanyl. What that does is any nerves that aren't numbed by the local anesthetic will be kind of wackadoo because of the fentanyl.
Okay.
Okay? Anything else?
Nope. That's
Okay. You have no contraindications for it. We've talked about those.
it. No.
Okay.
All right, so what we'll have you do is sit up on the side of the bed
Okay.
and get your back over here as far as you can, and then we'll have you hug baby.
Hug
Okay?
baby.
Yep, we'll have you hug baby,
Fine.
and I'll help you with that. No allergies, right?
No allergies.
Okay, so we're gonna get you cleaned off here.
Okay.
Use some iodine. 1, 2, go the opposite way. Make sure no tiny little hairs on your back are getting stuck. And 3. Okay? As that dries, I'm gonna put a sterile drape up here on ya. Okay? Let me actually do this. There we go. Tape it right there. Now I can feel your hips and stay sterile. Okay? Maybe a little excess. We're gonna clean that off. Alright. We're going to get our local anesthetic, which is lidocaine. Drop our lidocaine. Find our spot. Poke. And then inject as it goes in. Okay? As that's getting numb, I'm going to get my TUI needle. Okay? Find my spot. Right there. We're going to inject here. Okay, stop. I have an idea. So we've got the TUI needle in. Okay?
Okay.
Pull this out. We're going to get our loss of resistance needle. Connect it here. We're going to advance this. Whoop, okay, there's our loss of resistance. I'm in your epidural space now. Then you'd have your needle set up right here. Pull this out, put your needle in until it gets through 2 ligaments. You have a ligament on the outside of your spine and then a ligament in between your vertebrae.
Yeah.
Right? So once it's in between your vertebrae, it'll stay by itself.
Yeah.
That's how you know it's there. Make sure you're exactly midline. So if this is her back, go exactly midline. You don't want to be off center like
Yeah.
this. You'll get in a vessel.
And you have to, is there a way to make sure that you get it, you know, insert it straight?
Yeah, so what you can do is once you're draped, you can feel your spine
Uh-huh.
like come up like this, because it'll be draped up to here, so this will all be sterile. So you can feel your spine and like kind of work it down.
Uh-huh.
Some people have scoliosis in their vertebrae like that.
That's what I was going to ask about scoliosis.
Yeah, or lordosis where their back's like pushed out like this.
So that changes the curve. Well, it changes where it's going to be positioned.
Yeah, scoliosis, it'll be like this. So like you'll have like that depression in your back,
Uh-huh.
but the vertebrae will actually be over here.
Oh.
So you got to kind of like really follow
Feel
it.
for it.
Yeah. And then once you get that, so you got your TUI in, right?
TUI, what do you call
That's a
it?
TUI.
TUI.
If you look at the tip of that, see how the tip
Oh, yeah,
is kind of
yeah,
beveled
yeah,
up?
yeah.
The point of that is to take your catheter, once you think you're in the epidural space, which again is a potential space, that's
Wow.
part's kind of a big deal.
And they put that in.
Put this in. You need to know where your markings are. So that big marking right there is the tip of the catheter. See, as soon as we get to
Yeah.
Oh.
that blue right here is the tip of the catheter. So once you go further in, you're going to be pushing the catheter into your back. You know what I mean?
Mm-hmm.
So you push, like I said, about 4 cc's.
And it actually goes
4
up
cm.
up along?
Right.
Okay.
It's got that angle there, so it's going to be like that.
Okay.
Going up her back. Once that goes in, you push it in like, I don't know, like that far. Because you can always pull back. You can't advance anymore once you pull the TUI out. But you can pull back. So, you know, let's say this is her back.
I can use my hand in this.
Right. We heard go like this. Like, I don't want to hurt you. Like that. Okay. So you would just do like this. Keep the catheter there. Real slowly pull the TUI off. Once you get enough that you can grab, you can just like that.